So today I wanted to make a video kind of more personal, not really beauty related. I know as far as YouTube videos, YouTube has helped me with so many different aspects in life. I mean, people go to YouTube for everything now, from beauty tips to just stories to how to fix things on cars and everything. So for this kind of event in my life, I went to YouTube to hear people's success stories, or just to see people's stories in general on how they handled it and what they went through and things like that. My husband and I, we went through IVF, which is in vitro fertilization. We started going to the doctors in January of 2014. Before that, we did want to have children, and we both agreed that maybe it was time, even though we were both pretty young still. I was barely 20 years old, and he had just turned 21. So we would try, and after a few months, after things weren't happening, I kind of did my own little bit of research of ovulation kits and when's the best time to actually conceive and things like that. And after a few months of doing that as well, it still wasn't working. It was actually a year that we had been trying, and it wasn't working at all. So I decided to actually make the call to a fertility specialist. I did my research around the Phoenix area of basically who had the best reviews, who had success stories. They have different kind of charts of who does more certain kind of fertility treatments, their successes, things like that. And I found a fertility center that I really loved. It's called Southwest Fertility Center. It's in Phoenix. So I called and I made my first appointment, which shocked me because when I did call, it was about a month until I could get in. So I was even more stressed out. I just wanted to know if there was something wrong, if we could get help, or if I was just delusional or anything. So that month was really long. I actually went. So it was January of 2014 when I went to the doctors for the first time. And what they kind of do is they make you fill out a survey basically about you and your husband, your past medical history, and also just kind of like your sexual well-being history, things like that. So I did that my first visit, and then it was also a consultation kind of visit. So she talked to me, she kind of explained to me the different treatments that they have, but what are steps to, I guess, figuring out a diagnosis if there was one, and what I would be doing for the next appointment. Most of these doctor's appointments I went to by myself. So it was really hard. I didn't even tell my mom. I told a few family members on his side, but I was just so nervous to tell my mom, just because we were so young still, even though we were married and things like that. It's kind of hard to be like, hey, I'm going to a fertility center. Because even I didn't want to go, honestly, because you never want to hear that something's wrong with you. So I didn't tell anybody, and I did it all by myself for the first couple of appointments. Our situation was a bit tough as well, just because he was gone so much, and they put you on such a strict timeline that they basically tell you when you need to have intercourse, what day, what's the best time, how many days to hold off, and things like that. So it was hard. So we would have to base it off of his 30 days gone, and then his 2 weeks home, and then back again 30 days on. So that was a struggle in itself, and I could tell the doctors were really frustrated with that. So like I said, they basically they gave me a calendar and said, okay, so this is when your period starts, and this is when you're supposed to ovulate. You are supposed to ovulate 11 to 14 days after your first day of your period. So they give you certain days when to have sex. Basically, they would make you do the 2-week wait, and then they would call you back to come do your Hcg test, which is basically your pregnancy test, except they did it through blood draw. They also wanted to test my husband just to rule out any factors of him. Sometimes it can be the male, sometimes they can have low sperm count, sometimes they can have abnormal shapes to where it's not moving the way it should. There could be multiple reasons why people can't get pregnant on the men's behalf. So they did his test, they did a sperm analysis. The first time they did it, it actually came back that his mobility was pretty slow, so they weren't sure if his sperm was going to penetrate the egg the way it should. So they did another one and it came back perfectly fine, which that is always good as well, because another problem would be having to treat him as well, and we just didn't want to add more and more onto it than we already had. So he did that, his came out perfectly fine. They did bring up the possibility of ICSI, which is basically where they take one of his sperm and my egg, and they basically put the sperm in with a needle into the egg, just so that it makes sure it does penetrate and does get through the egg's wall. But luckily we didn't have to go through that. That's also another cost that they do have to add on to there. So after we did that, the first time, our pregnancy test came out negative. So we went on to the next step, which was basically another month of a normal cycle. I had gotten my period. I went in for ultrasounds, kind of around the days when they'd see that I would ovulate. So they did see that I was ovulating, so they seen that there wasn't a problem there as far as releasing an egg. The second test that I had gone through was a fluid sono, which is basically a fluid sonogram. What they did, it was an in-office procedure, and it's basically where they put this kind of saline through your cervix, and they see it through the ultrasound, and they basically check your whole endometrial cavity, just to make sure there's no polyps, anything that they would see suspicious. And luckily they didn't see anything. My endometrial cavity was perfectly fine. So then they went on to the second procedure, which was an HSG. And that has to be done actually at an office where they do x-rays. And how this one worked was you laid on, it was basically a metal kind of flat surface. I don't want to say bed because it definitely wasn't bed, but it was metal. And they also put a catheter through your cervix. What the dye is supposed to do is it's supposed to flow through and then come out through the tubes and just release into your body, and then it would just naturally go away on its own. And then when the dye is going through, they are taking x-rays to see if it's actually doing what it's doing. They said it was going to feel just like a period, nothing crazy, but it was so painful. I remember just sitting there about to cry, and I just wanted to throw up so bad. It was so painful, and I didn't understand why, because to me I was like, period cramp does not feel like this whatsoever. But I took the test, I went home, I rested for the rest of the day, and I went back to my doctor's appointment when it was scheduled at the Fertility Center. And she had gotten the results back from the radiologist who did my x-ray for the HSG. And that's when she broke the news to me, saying that basically the fluid that they injected, the dye, was not going through my tubes. It was basically just sitting there all stuck, nothing was going through, and it was through both tubes. The actual name for my diagnosis is called bilateral hydrosalpinx, which is basically your tubes dilated with fluid. That's why nothing was getting through, and that was the answer to why I wasn't getting pregnant for so long. Your tubes are basically your passageway. If nothing's coming out and nothing's going in, there's no way for that sperm and that egg to meet up. So there was no way, nothing was getting fertilized or anything. So that was the problem the whole time. And I just remember it's a devastating thing to hear, that you can't have kids naturally the way, you know, everybody else does. it was hard, especially me being so young. I was envious of basically all the people that I would see just getting pregnant, just from random things, not getting pregnant because they wanted to, but getting pregnant on accident. It hurt so bad. I would see it and I remember I would just cry, and I just didn't know what to do. I blamed myself for so long because I was like, what's wrong with me? My husband's probably not going to want to be with me anymore. And it's just, there's so many things that run through your mind when you hear something so crazy like that. In my eyes, I'm like, I'm a woman. I'm supposed to come onto this earth and have a family and give birth to children and just be a mother, and that's your main goal in life. That's what, I mean, you dream of that when you're a little girl, to get married and have a family and things like that. So to know that I had to go through such a struggle to get pregnant was so hard. That day I did find out. That was the day I actually told my mother that we were seeing a fertility specialist. And I told her basically what was wrong with me, and she just didn't understand either. She says, but how is this possible? And I mean, I myself don't even know how it's possible. When I asked my fertility specialist, you know, how does this happen? She says there's so many reasons why it can happen. We can never actually pinpoint out the reason why. So I didn't even know how it came about, which sucks because you want to know how something so crazy happened. So yeah, it was crazy. It's like, I could still feel every emotion that I felt when she did tell me that. And she was explaining to me how a woman who can conceive naturally, she gets the 20 to 25% chance of getting pregnant each month, and mine was basically at 0. That's when she went ahead and told me that the only way that I can carry a baby and a healthy pregnancy would be through IVF. IUI, I was out of the picture just because they couldn't meet together. So that was my only option. And at the time, I didn't realize how much IVF did cost. I came home, did my research about basically everything that she had went over. I was just obsessing over it constantly, always reading about it, driving myself crazy, and the cost was insane to me. It was close to about $14,000 with the procedure, with the medication and everything that I had to take, and of course my insurance didn't cover it. It was all out of pocket pay. I mean, it's free for some people to just have a baby and they have no problems, and for me it was costing me so much money, which stressed me out, that I felt like I was stressing my husband out, because it was something he really wanted. He's always wanted kids. He's always been good with kids. So at the next doctor's appointment we had, it was basically like another consultation. She went over what needed to be done next. That was actually a tubal ligation. She said what we're going to have to do is tie your tubes, just because the fluid in there, we do not want it to affect a baby if you are carrying one whatsoever. We don't want it to leak out. We don't want it to harm any baby. Basically, we don't want anything to go wrong when you're investing so much time and money and emotions into something so big. So I remember it was June 22nd of 2014, and I went in for my surgery for tubal ligation. They did 4 incisions. They did 1 right above my pubic bone, 2 on the sides, and 1 into my belly button. And she went and she cut off 1 of my tubes, so 1 is not even connected at all, and then the other 1 is tied off. Now with that surgery, I had to heal for 6 weeks, of course, and then I went in for my post-op, and they just checked and made sure everything healed perfectly fine, that I didn't get no hernias. Now when me and my husband were talking about just getting my tubes tied and everything, of course the question of what happens if we drain the fluid, and just kind of reconstructed my tubes so that way there could be a passageway to meet with my eggs and things like that. And we brought that up to my doctor, and she said yes, that is possible. It is an option as well, but it is an extra $2,500 on top of the surgery cost. Plus, your percent of getting pregnant would be less than 5%. So it was a 15% to 20% chance, still lower, of those who can conceive naturally. And to me, that was just so low. I was like, that's nearly impossible. And she said, yes, it's very hard. Some people still don't conceive after that. And either way, they still go to IVF. So I kind of took it upon myself. My husband let me choose myself whether I wanted to do that or not. And I decided not to go that route. I just wanted the best possible route that I could get. So he let me do basically anything that I wanted to do. It was hard for him to understand too. There was a lot of things that he didn't understand, but he let the decision be up to me for everything that I had to go through as far as procedures, if I needed any extra surgeries or things like that, which luckily I didn't. That was the only surgery that I did have to go through. So after healing and everything, we kind of took a break from the whole fertility thing. We didn't necessarily want to stop because we wanted to. We wanted to kind of gather up the money, gather up our thoughts. It was just really stressful. We waited about 6 months to get everything started again. The whole procedure took about 4 months to do. So in February we started. The IVF coordinator, who I love her, she was amazing. I always wanted to go to her for everything, even after the whole treatment was done, and even when I actually had to go on to an actual OB and stop seeing them. I just wanted to see her. She was amazing. She was so supportive. She answered all my questions even though I couldn't understand half of what was going on sometimes. She was very patient with me, understanding that me and my husband were a younger couple than some of the couples she does see. So it was a really great experience with her. So what we had to do to start the procedure was we had to start myself on medication to get multiple eggs to mature, so that way we had multiple eggs to retrieve. So we started off with Menopur and Gonal F. And what those are injections that you do in your stomach. It's I don't want to butcher it, but it's subcutaneous, I think is how you say it. You basically just pinch the fat of your stomach, stick it in, and inject it. Menopur burned really bad. I hated taking that injection. It was the worst. Gonal F, it was just easy 1, 2, 3. When I first had to do my injections on my own, I couldn't do it. It was so hard. I cried so much because I just didn't want to go through it, and I couldn't believe that this was happening to me, and that's all I kept saying was, I can't believe I have to go through this and things like that. But I finally just grew some balls and did it myself, and then I started doing my injections every day by myself. It hurt to grow so many eggs at once, and they were growing on both ovaries. You could feel it every time you walked. It was pretty painful. I mean, it's nothing that I couldn't deal with. I could deal with it, but it was so uncomfortable. Certain things to do were uncomfortable. I had to wear loose-fitting pants just because the tighter the pants, the more I was constricting that area and squeezing them, and it just didn't feel good. So also with that, I also took Cetrotide, which is basically to suppress ovulation until they are ready to make you ovulate with another injection. They basically want full control over your ovulation and your whole cycle when they are trying to retrieve your eggs. The doctors want to make sure that there is nothing that is being taken over by your body naturally, that it's all them taking over and doing what they need to do to make sure they get as many eggs as possible so you have the best chance that you possibly can. So I took that to suppress ovulation. So I went to ultrasounds almost every single day. I think it was every other day I went. And they had to keep measuring almost every single egg. They had to see how they were growing, how fast they were growing. They had to see to make sure how much of a dosage they were giving me. So if they can add more or if they should take off some, just because they didn't want to hyperstimulate my ovaries. So I had to be over there quite often, which was kind of a pain because I don't live anywhere near Phoenix. I'm a good hour away, so it was a pain to every day almost be over there. Now, after they decided that everything was good, I had my Hcg Trigger shot. The Hcg Trigger shot triggers ovulation. So as soon as they do that, a few days, maybe 1 to 2 days after, that's when they actually go in for your egg retrieval. Now, your egg retrieval is when they go in and they take a tiny, so small, super small needle. It goes through your cervix and in through the vaginal wall, and they basically suck out whatever eggs they need to. You are under anesthesia for that. I was under propofol. It was a 20-minute procedure, so it wasn't long at all. I think I woke up after 30 minutes. What I did like about it is I didn't feel groggy or anything when I woke up. It wasn't like the anesthesia you get when you have surgery and things like that at all. So we did that, and it finally felt better. My ovaries didn't feel like they were the size of 2 planets inside of me. I believe they counted that there were 54 eggs in total, but only, I think, about 23 matured. And after going through and seeing which eggs were the good eggs and the bad eggs, I believe there was 19 eggs total that they could freeze. Now, after my egg retrieval, they put me on another injection. It's called Lupron, and what that basically does is it stops ovulation completely. They didn't want me to hyperstimulate, which I was kind of on the verge of because I'm so small, and even the lowest dosage was making me produce so many eggs. So I was on Lupron, and the way that it was looking was I was pretty close to OHSS. So I had to wait another month to actually have the eggs put back in me, which really sucked. I was just devastated. I didn't understand when people say that you have to have a lot of patience for IVF until I actually went through it, because it's literally a roller coaster ride. You can have an up, and then in 2 seconds you can have a down. You never know what's going to happen next. It's really just science kind of fighting with nature, and you have to always be prepared for what might happen or what they might say, or even in my case having to wait another month even after you were so excited thinking you were going to be pregnant this month. So we had to wait, and it wasn't that bad. It actually gave me time to actually get my body feeling back to normal. So we waited for that, and then on April 22nd, they actually went in and they put the eggs back into my body. What they call them are blastocysts. They grade them kind of by A, B, C, D, kind of like when you're in school. Mine were not completely grade A. They actually weren't the best, but they were still good. So originally I only wanted to put 1 back in. I knew the risks of multiples. I am scared alone just because I'm so small, and I didn't want to carry 3, 4, 5, however many kids. I was really scared. But when she came in, she explained to me that, they aren't the best. She said it wouldn't hurt to put 2 because even 1 might not stick. So me and my husband had to make the quick decision right there and then if we wanted to put 2 or 1, which we did decide to put 2. I think the only uncomfortable thing was the speculum, obviously, because it's stretching you and it's cold, and it's not a comfortable implement that they use. So that was the only uncomfortable thing, but everything was so painless and it was so relaxing, and they even put on relaxing kind of like spa music just to make sure that you're not stressing out and you are just trying to have the best experience you can, because you're pretty much you're conceiving right then and there. So it's a special moment. They really made it special for us. I loved it. It was amazing. After they did that, I was also on another injection and one pill. It was estradiol, which is basically estrogen pill, and that is to make sure that your endometrial lining is nice and fluffy and sticky, so that way these blastocysts can stick and they can grow and become beautiful, healthy babies. And then the progesterone oil is basically what it is. It's progesterone. It's also aiding into the whole conceiving process, and it's kind of almost like your backup. They want to make sure that this works, that you don't have to go through this a million times if you don't have to. They just want to make sure that you have your best possible fighting chance. So I was on that. I had to take the progesterone oil injection up until 10 weeks of pregnancy. So it was annoying. It hurt just because it's intramuscular. So it's considered your butt, but it's kind of more of your hip. Your muscle will hurt, of course, because you're being poked every night. So it's annoyed, it's irritated, it's just, it hurts. There were some days where I would wobble into work. It was not fun, but in my head it was what I had to do just to have the dream and the family that I always wanted. So it sucked, but it was all worth it in the end. I am now 15 weeks pregnant. I do have twins, so I'm pretty excited. It's the biggest blessing I've ever had in my life. They are fraternal. They are not identical, just because they did put 2 separate eggs in and neither of the eggs split. So it's fun. In about 3 weeks we get to find out the gender of both of our babies, and they're growing so perfectly. I thought it was going to be way worse than what it sounds like, but it wasn't, and it's so great to actually have this kind of technology to give women and men, or even couples or anybody, the dream that they always wanted when it doesn't really turn out the way that they had hoped for or planned for. So it's really, it's a rewarding thing, and I can't wait to be a parent. I want to say the hardest thing about the whole experience is not the injections, not the surgeries or the procedures, it's the emotional part. You have to be really strong. I am in no way, shape, or form a strong person. I could cry over anything, honestly. And I just had to teach myself that if it'll happen, it'll happen. And luckily it happened our first try, and I couldn't be more grateful for something so amazing. So that would be my advice to anybody who has to go through IVF, is just be strong and everything will work out in the best way it possibly could. It's a hard thing to go through, but when you finally listen to your baby's heartbeat or see them on the ultrasound for the first time, or even for me, it hit me so much when I started seeing them move so much. You'll wonder why you were so scared in the first place, or wanted to give up in the first place. I'm so happy that I didn't give up, and I know how many times I really wanted to, and I'm just so happy I didn't, because I wouldn't be blessed with 2 beautiful babies, even though I don't even know what they look like, but to me they're just the most beautiful things on the planet. And even like the look on my husband's face whenever somebody talks about them, or when he actually realizes sometimes that, wow, I'm gonna be a dad, it's amazing. It's so emotional and beautiful. It's awesome. So that would be my advice to anybody who has to go through any kind of fertility treatment, not even just IVF, anything. It's hard, but it's so worth it. So yeah, I think that's about it for this video. I don't think I have anything else to say, so thank you guys so much for watching, and I will see you next time.